Hi, this is Ashley Peska, and I am doing my week 5 assignment, which is diagnose and recommend treatments for depressive, bipolar, anxiety, obsessive compulsive, and related disorders. First, I chose Mr. King's story, he is a 52-year-old male who's never been married and he works as a janitor. He was initially presented for depression, and he has previously utilized fluoxetine, citalopram, and supportive psychotherapy for his depression, but he's had minor improvements for years. And so that is why he has come in to be seen. The diagnosis that I chose for Mr. King, due to his story and from what I gathered from his case, is obsessive compulsive disorder 300.3 and F42.2 with good or fair insight and no tic-related behaviors. It was hard to differentiate for Mr. King at first. His diagnosis as specific phobias and are also social phobias, as due to they could be in line with an anxiety disorder. However, the anxiety disorders such as the phobia and social phobias, due to that category and due to Mr. King's rituals such as his washing of his hands 30 times a day, also utilizing of household bleaches, the wearing of the gloves, and also his worries and going over the conversations in his head, also the level of water in his bathtub, don't fit within the anxiety disorders as having rituals. So that is the reasoning for why I chose OCD 3003 with good or fair insight for Mr. King. Also, to just kind of go into a little bit further about the diagnosis I chose for Mr. King is his worry of contracting diseases, particularly HIV. His cleaning behaviors that are related to his worry about contracting HIV, and his avoidance of touching anything outside of his home. It is very interesting that he's a janitor, and that he is wanting to, have everything clean, but yet he doesn't want to touch anything outside of the home, so he does wear gloves as doing his duties. The ritual of washing his hands an average of 30 times a day, and then the addition with the amount of times and the amount of time that it takes for him that affects his day. He said that it does take hours out of his day in regards to washing his hands, and also the use of household bleach that can be harmful to his skin, and just trying to get himself clean. He avoids shopping and public transportations and has a lack of relationships, both social and romantic. He also worries about things that he may say that others may take in the wrong way. And so his ritual for this is that he constantly is replaying his conversations and also keeps a diary of his conversations. And also he has a fear and has a ritual of keeping the water level in his bathtub at a certain level to not flood the neighbor below him. All of the previously mentioned fears and obsessions and compulsions are in line with OCD. Mr. King is aware of his thoughts and that they are kind of crazy, as he puts it. So he does have fairly good insight into his behaviors and knowing that these behaviors are a little out of the quote-unquote normal behaviors of an individual who doesn't have a mood disorder and a disorder of his kind. Based on the OCD diagnosis, and kind of going over the psychopharmacological treatments, psychological treatments, family therapy-based treatments, and then biomedical treatments, Psychopharmacological treatments are SSRIs or medications, such as his fluoxetine and citalopram. However, those would not be good choices, as he did not see good improvement for those. They were utilized to treat depression rather than OCD, so that may become a difference in looking at the medications for him. Psychological treatment, the best for OCD has been found to be cognitive behavioral therapy with exposure and response as a treatment. Assisting individuals to practice exposures to the things that they are concerned about and practicing their responses and helping them to come up with healthier responses to those treatments. Family therapy, again, cognitive behavioral therapy with exposure and response as a treatment, this time with the whole family to learn and engage with the loved one, to learn the communication and problem-solving skills. Biomedical treatments can be brain stimulation therapies. Kind of going over the different pros and cons of the different treatment styles. First, the psychopharmacological is the International OCD Foundation states that the research has proven that medications such as SSRIs can be helpful for individuals to manage their OCD. Some cons to this, however, for individuals with OCD can be that some may have side effects that could be damaging or could also continue a concern of contamination. Putting medication into someone's body that could further their worry of being contaminated. And so trying to work with them on that response and working with them to take the SSRI and medication to help manage the stimulation in their moods. Psychological treatment, therapy with SSRIs as a combination has been proven to be more successful for individuals with OCD, and this is according to the International OCD Foundation. The psychological treatment can be done on its own. However, it has been proven for individuals with OCD that it is more effective for them if it is paired with an SSRI. The psychological treatment, however, does need to be with a therapist who is specifically trained in the CBT, cognitive behavioral therapy, and certainly if the therapist that the individual is working with notices that their treatment strategies are not working well, then they need to take the proper precautions and assisting the individual to finding a therapist who does better suit their needs and who can better provide the proper therapy. Family-based therapy, the International OCD Foundation states that the cognitive behavioral therapy utilizing the techniques of exposure and response preventions has been shown to be the most effective treatment for individuals with OCD. Family therapy can be a benefit to the individual and to the family to assist the individual in their relationships with those closest to them. Cognitive behavioral therapy with ERP is helpful for the family members to assist their loved one with OCD on how to manage their anxieties and also how to avoid stimuli. It isn't a con to this could be that and maybe not so much as a con, but more so as a hurdle, is that for all members of the family to identify and take ownership of their personal progressions and progress and work towards solutions to work and live with their loved one with OCD. And certainly getting everyone kind of on the same page is going to be crucial in order for the family therapy base to work. Biomedical should be at all costs a last resort. These are very intrusive and very detailed and hard treatments for individuals. The biomedical treatment that I chose for OCD as a possibility, but as I said, this should be like a last resort. This is if psychotherapy and SSRIs are not working at all. There's a very high risk of suicide. The life quality is not high, it's not well, is deep brain stimulation. Deep brain stimulation is when there's a set of electrodes that are implanted into an individual's brain and is controlled by a generator that is implanted into the individual's chest. These implants provide consistent stimulation that can be customized to the individual and their needs. The deep brain stimulation was initially developed for individuals with Parkinson's disease, but there's currently been a humanitarian device exemption for the possible treatment for individuals with OCD. As I said, the con of deep brain stimulations are that it requires a brain surgery and very high intense medical monitoring after the devices are implanted. An individual such as Mr. King who has a fear of contamination, this could be very difficult, as the fear of being contaminated while in the hospital could be a greater fear. Also, implanting something into an individual's body with OCD, if they have that contamination fear, that could be something that's not going to be a benefit, as putting something into their body could raise their fear of contamination even higher. Also, deep brain stimulation should only be utilized, like I said, as a very last resort if individuals' lives are in danger due to suicide risk, and also consideration of their quality of life. Other side effects of deep brain stimulation are possible brain bleeds and strokes, an infection, disorientation or confusion, unwanted mood changes, movement disorders, lightheadedness, trouble sleeping. This is also a fairly new treatment, and so long-term benefits and also side effects are still unknown. And all of this information was found through the National Institute of Mental Health, through the National Institute of Health website. And so, again, there's all these different treatments, but the treatment that I would move forward with for Mr. King is to do a mix of psychopharmacological and psychological treatments together, working to find a SSRI that is going to benefit Mr. King, along with working with the cognitive behavioral therapy with exposure and response as a treatment, and seeing if those together can be a positive for him working towards a goal of his, to have better relationships and to lessen his thoughts that he knows that are kind of crazy, as he puts it, and working to lower those impulses and complications of OCD.